Good afternoon, everyone, to the Jefferson County Board of Health Staff Study Session. We have a great presentation today, but the very first thing I want to do is to introduce our language justice representative, which Lynette, I understand you're going to be our representative today for the language justice. There she is.
Yes.
Thank you. Welcome.
Gracias, Sherry. Thank you so much, Sherry. Hi, everyone. My name is Lynette Garcia. Hola a todos, me llamo Lynette Garcia, and I'm here with the Community Language Co-op. Estoy aquí con la cooperativa. And I'm here because the organizers of the space have committed to practicing language justice. And what that means that everyone in the space can listen into the language of their heart. Today, we will be doing a Spanish interpretation into Spanish. Quiero primero que nada agradecerles a los organizadores de este espacio por crear la justicia del lenguaje, por asegurarse de que todos en este espacio puedan entender el idioma de su corazón. El día de hoy habrá interpretación simultánea al español. In order to turn on, interpretation is not turned on just yet, but as soon as it's turned on, you will see a globe at the bottom of your screen where there's a drop-down button that shows Spanish and English. Please select the language of your heart there. En cuanto se aprende la interpretación, aún no se ha aprendido, va a haber un globo terráqueo abajo en su pantalla donde pueden seleccionar el idioma de su corazón allí. Van a haber varias opciones y pueden escoger donde dice interpretación. However, friends, if you are on a tablet or on a cell phone, there's 3 little dots to the right of your cell phone that say a couple of things, and then it says interpretation. You select your language there. Si están en un celular, en una tableta, por favor, van a ver 3 puntitos a la derecha de su celular donde dicen interpretación. Allí pueden encontrar el idioma de su corazón. And I think, just a quick reminder, if there is anything, if there's any questions with interpretation, if there's something that you can't hear, please do not suffer in silence. Let us know. Put it in the chat and we'll make sure that we take care of you. Por favor, asegúrense de si hay algún inconveniente con su interpretación, no sufran en silencio, pónganlo en el chat y nos aseguramos de que podemos trabajar con ustedes para que funcione. Spanish is 15% times longer than English, so just make sure that by the time we're saying something, I might be midway, and I want to capture every emotion and everything that is being said, and also in Spanish. El español es 15% veces más largo que el inglés, entonces si están diciendo algo en inglés, por favor asegúrense que hablen un poquito más lento para poder capturar cada emoción y todo lo que esté diciendo. Okay, and I think that should be it. Thank you to the organizers of this space.
Well, Lynette, thank you. I want just a little bit of your enthusiasm and spark. You are great. Way to start the meetings. Okay, so everyone find the little globe at the bottom and go ahead and select your language of choice. And with that, let's just jump right into it. Allison Wilson, I believe that you are going to be our presenter today for Advancing Breastfeeding in Colorado 5-year project snapshot. And the Suente, I'm not going to say that right, so I'm just going to let you say it. Allison.
Thank you so much, Sherry. Everyone hearing me okay?
I think so.
Oh, okay, great. And you can see my screen. Perfect. Good afternoon, everyone. So glad to get to join you for this study session today. I am Allison Wilson with Jefferson County Public Health, and then Kelsey Rivera, our WIC lactation supervisor, was also a big part in this project, along with so many other staff and partners that I won't have time to mention today, but Kelsey is on for questions or to give some insight if needed, but this time is also with her school pickup. So graciously, she's just on audio because I said, don't try to do this with me. I'm going to give a quick snapshot first, and then we're so excited that Cuenta Conmigo Cooperative is here to really share their community leadership in this work, the insights they have gathered, and how they are really continuing this work forward. And so thank you so much for having us today. And I'm presenting from New Orleans, actually. I'm here for a maternal child health conference. It's amazing, but please someone let me know if the internet gets spotty. I tested it a few ways, but you know how it is from hotels. So our project just finished 5 years of funding. This project was funded from the State Health Department through their Cancer, Cardiovascular, and Pulmonary Disease program as a way for chronic disease prevention, because we do know from research and science that breast chest feeding is is helpful in chronic disease prevention. So we received $3.5 million total over the 5 years. And that was to a team. We had a core team of really in Denver Metro, 6 health departments, ourselves at Jefferson County, as well as Boulder, Denver, what was Tri-County, Adams, Arapahoe, Douglas, and Colorado Health Institute was our amazing facilitator, evaluator, and fiscal agent for the project. And we had also someone out in Durango supporting a lot of our non-metro work. So today I'm really just giving y'all kind of 5 years in 5 minutes, maybe, or a little more. But we will have a beautiful report from Colorado Health Institute that I'll have Lindsay email out and to share with you all some more details. And that should also be on their website for public as well. It really was a statewide effort. You know, all of our health departments did have a coordinator like myself that I had mentioned, but then we also were able to partner with 47 counties statewide. And really the goal was that families had support to meet their feeding goals. We'll briefly talk about data, but we saw that almost in Colorado, it's 90% of families initiate breast chest feeding. They have that interest, that knowledge, that awareness, but then they are running into barriers with support, going back to work, different navigating the health system. So we were really looking at policy and environment change. And then also a big thing that came up through the project was community leaders and others wanted increased access to lactation training so they could really hold that knowledge in their community and support their communities. So through this, again, I'm just giving some pretty quick highlights, but we've got toolkits that are have an assessment and kind of a process to recognize businesses. There's a toolkit for businesses, childcares, and medical offices to go through a process to be lactation friendly recognized. For childcares, it's actually certified because there's a recertification process. It matches some of the statewide work with Colorado Shines. And that was really important. It matches, our state already has some great policies in place, workplace accommodation for nursing mothers, but that awareness isn't always there. So this was a great way to raise awareness. We had 400 locations across the state recognized as lactation friendly. Most of those were either businesses or childcare. The medical office process is pretty involved. So that was a smaller number, but we're kind of reevaluating that. And 286 individuals were able to do lactation training. And we were looking at it because we really heard the need for further lactation training that was much more culturally responsive. And so out of that, 150 really were taking training that was much stronger to match their community and what they saw as needed for greater equity in the lactation training space. And Cuenta Conmigo had a big role in that they may be able to briefly share. But with that, with our partnership with Cuenta Conmigo, they created a 55-hour lactation course, and I'm super excited. We just found out last week that a national exam entity removed a couple barriers we saw, so that folks that take that course that we now have in Colorado, they can directly sit for the exam to be certified. And that's really important when we think of equity as far as that certification for billing, for hiring. So it's really exciting to see that start to make some shifts for some changes nationally. And then we were able to distribute mini grant funds to 92 community lactation projects outside of Denver metro area. And super excited that the work does continue. Our funding did end in June, but these partners listed here are helping carry forth a lot of that group for lactation support groups, trainings. So you see here, there's WIC, Metro State University is doing a lot with the lactation trainings. Mother's Milk Bank has always been an amazing partner, the Colorado Breastfeeding Coalition, Triad Early Childhood Council, and then Cuenta Conmigo Cooperative, who you will hear soon how they're carrying forth the work. Lynette, I hope you're doing okay. Just realized I might need to take a breath there. I just have a couple more. And so I just wanted to do a quick local highlight. We did have 45 businesses in Jefferson County recognized, and that included a lot of spaces, where families are going, such as the whole library system and all their locations. We worked with the school district in about 25 schools. You see the picture here is Premier Members Credit Union. They have locations all throughout Denver Metro, and they had a great solution of a pop-up lactation station in some of their micro branches that are really don't have a separate space, but we were able to come up with a good solution with them. So great work in the business world as well as childcare's lactation friendly certified. A lot of those through our partners, like I said, Triad, and also especially Cuenta Conmigo and PASO program with in-home childcare providers, as that's the majority of our childcare providers. And so we also worked with Jefferson County to just update spaces that are in the county buildings, as well as human resources to think about how they can proactively communicate to employees the support as part of their work to be employer of choice. And thank you to Board of Health. We did a couple of breastfeeding month proclamations with you in these years. That matches National Breastfeeding Month and World Breastfeeding Week in August. And through this project, there were emerging needs identified that we hadn't necessarily written in our grant plan, and thankfully our funding was flexible. And so a big thing that came out of some of our early work with Cuenta Conmigo, maternal child health, and our emergency preparedness teams was safe infant feeding in emergencies, and having a plan in place if a family with young children has to leave their home temporarily or is stranded because of a disaster or other displacement. So now we have a full plan, and we continue to expand that statewide with Medical Reserve Corps and looking at broader access and functional needs. So that's been an amazing partnership that continues from this work. And then, as I have mentioned, we've been a foundational partner with Cuenta Conmigo Cooperative, and we were able this last year to receive a national award from the Association of City and County Health Officials to just support their work. So they will share more on that. My final couple of slides was just, we do keep obviously monitoring the data, and I'm so glad Cuenta Conmigo today can tell more of the qualitative stories and real-time information they're getting, as that's equally as important. Our quantitative data here is a little bit always delayed, but these last two blue columns kind of show the work that Cuenta Conmigo is doing to close that gap. So this chart here is what are the breastfeeding rates for infants 2 to 4 months after delivery. And as I mentioned, we know everyone, regardless of age, education, ethnicity in our state, really start at that 90% level, but then we see these disparities because of different lacks of support in health systems, in knowledge and access. And so this is from our recent community health assessment, and it'll be exciting to watch in future as hopefully this gap continues to close between our non-Hispanic populations and Hispanic and communities of color. So we've had a lot of growth. They call it the ecosystem. I couldn't put all the partners on a slide, but just some there to see the growth. Our leaders, our community leaders, are now presenting on CDC webinars, model practice for other states, sharing examples. I love seeing the faces here, doulas, childcare providers, the celebrations for Lactancia Latina Week, the work with groups. It's grown over the 5 years. When we're grateful it continues. So I'd love to turn it over to Cuenta Conmigo Cooperative to share their part in the growth and their part in the leadership and growth of this forward. So thank you all.
Thank you, Allison.
Hello, everybody. It's Paulina Arizas. It's so good to see you all again. And now from this side of the world in community, I believe we have Susie, Lucy, Cynthia is there also in the line, and they're also in Pickup Beauty. So I just happen to be lucky that my daughter is home today from school. But it's very nice to reconnect with you and share with you, and kind of share is together the kind of work that we have been doing last years. And have to like I keep thinking about the history of this, right? We started Adelante Jeffco in 2018 from the Adelante Jeffco, now called Conectando. We had several groups of people who connected with us in the health department that engaged deeply in the work of public health at community level, who took ownership. And this led to multiple projects from navigators, family friend neighbor providers, supports, and of course, or lactation counselors in the community. So what we do is weave networks of support. We want to make sure that every family who's having a little one and welcoming a little one in their life has someone in their very close network who knows enough about breastfeeding and lactation to support them to get the support they need, right? To connect them with lactation counselors, even like mental health specialists, navigators. We do so much more. I don't know. We keep thinking about lactation, and this project was certainly about lactation, but in the doing, as we're building this plane, as we're flying and building the plane at the same time, we realize that the role of the lactation counselors at community level plays so many, like it crosses boundaries of geographical boundaries in the counties we serve, as well as kind of field discipline type of boundaries. This work was possible because of the partnership between three big important entities and so many more. Jefferson County Public Health provided the funding mechanism we needed to be able to have a strong structure to get awards from nature, right? And that helped us also align with the health priorities for the county. We knew enough. We were dangerous enough, I will say, but working with the health department helped us expand and align with other projects. Then the Edgewater Collective, another nonprofit in the community, happened to open an incubator for cooperatives. So we were invited to participate. They made adjustments for us because we were already working. We're not a brand new group. We have been doing this since 2019, from certifying family, friend, and neighbor childcare providers to providing groups, doing one-on-one support. Between 2019 and 2020, our counselors received over 90 hours of lactation education that then we were able to utilize and use to connect with families throughout the pandemic. A lot of our efforts during the pandemic were to make sure that people have food at their table. So then moms could breastfeed. So then families could have options and choice in how much longer they wanted to nurse and how they could access the supports needed. And by 2022, 2023 is this year, right? So 2022 is when we decided, what is it that we're doing? What do we want to keep doing? And Edgewater Collective created that space for us to then become a cooperative business that has a strong connections to community that leads from a justice approach, and that's how Cuenta Conmigo came to be. And then we bring knowledge, we bring expertise of working in community with community, developing our projects. Next, please. We usually in this presentation, we present a beautiful picture of the mountains in Colorado. I think you can all picture that in your brain. However, for us, it's also important to have a critical sense of what we're seeing, what's in our map. This is from the Child Opportunity Index that maps out opportunities for children under three different dimensions. This shows where most of this opportunity, the lighter blue, shows the areas, the geographical areas, the neighborhoods where children in the Denver metro area has less opportunities, and the darker blues show where children have more opportunities. These areas in the lighter blue is where we mostly work. It's also where most of the immigrant communities live, and it's also, especially in the west side of the state, of the map, it shows what redlining areas existed, and we can see still the legacy of those historical times. Next, please. So what Cuenta Conmigo does is we become a touch point for those moms, families, dads, grandparents, neighbors who are taking care of children in their life. And we help connect with resources, support, companionship, so then their journey can be a journey that includes happiness and good memories and love and care. And whenever there are challenges, then they can have the tools and the resources and the information they need to make their own decisions about how they want to move forward. And we're there with them. Next, please. So how do we do this? We are increasing community capacity. We're training people culturally in a culturally responsive way within the language of their hearts. It's so invigorating. Participants feel moved to implement what they have learned. We just spent a week, Lucy, Susie, and I, and Esther and Cynthia, as support, spent a week in Arkansas. I never know how to say it, but you probably get what I'm saying. We spent a week working with a group of about 12 home visitors in the University of Arkansas with the Healthy Starts program who wanted to learn more about lactation and breastfeeding. And they wanted it in Spanish. And they wanted it culturally friendly, like value. They wanted to know from our experience how to do this work over there. And on last day, they had a plan. They were ready. They didn't want this to be just one more training. No, they were ready to jump in and do and implement it and embed this information into their curriculum and their visits. Next, please. With that, Lucy has been leading the safe infant feeding and community preparedness training over 40, I think it's more than 60 people at the end of the project. These numbers may be a little lower than we finish with. We provide a community lactation access. That's the CLAP curriculum, 55 hours of lactation, clinical lactation work to over 30 people in the state. Esther and Cynthia provided childcare providers lactation-friendly certifications for family, friend, and neighbor providers, and over 60 of them certified, and over 100 got trained on it. We also host monthly study sessions, and we have people joining from California, from Florida, from different parts of the state, actually. And we offer CERPs, continuing education credits, for them to continue their certifications. Next, please. I'm going to speed up a little bit, just so we can have some time for questions. We have also increased our community presence. We have groups in person in different locations. We were doing virtual, we stopped, and now we're going to start doing it again, doing some classes virtual as well. And we have a phone number that people can call. And we have cafecitos. They're groups in the community where people find partnerships that reflect community interests, where we can embed different other topics from infant mental health, community resources that align with their current interests. We, in this way, can bring in a wide spectrum of expertise and connections. We actually co-host with Lifespan Local with mental health providers. So we have a whole team there ready. Next, please. We have a phone number that is being given to families who give birth in Lutheran, who is all under approval process at Denver Health. And we continue listening. We have always been listening to community, and we recently, because of this grant, were able to do a qualitative study. We use a photo voice for this. Next, please. In which we ask families to please send us 5 pictures of their day in breastfeeding. And then we met with them for in-depth interviews in which people were telling us about what those pictures mean to them. In this way, we're able to identify topics like the themes that come up in patterns and recurrently in the experiences of our families, the barriers that they experience to establish their breastfeeding relationship, to go back to work, what is needed to continue providing human milk to their babies. They really are. We're looking at the whole experience so we can respond from our whole experience as well. We are building trust and companionship as we're learning and listening. And then this allows us to create interventions that are effective, that they are cost effective too, not just from the results, but that we can also implement at community level and develop partnerships to work together. So next, please. I think I mentioned most of it. This is the list of everybody who's working here. I just met, and this is new to my team, I just met with Metro State University, and they are also, we have been in conversations for a while. They're also interested in working with us, reviewing curriculum, looking into how do we open more space and remove barriers for people in the community to also get trained in lactation in community. So that's all for me. I don't know, Alison, if you have something else to add, or if you have any questions for any of us.
Thank you so
Thank you
much. That's
so
a great presentation.
Thanks.
Board members, do you have any questions for Paulina?
I was wondering how you're being funded now that the grant money is gone.
Thank you for that question. And I forgot to say, we also hosted the first ever Semana de la Lactancia Latina, that's Latina Breastfeeding Week. We're part of a national group of leaders in lactation, and we were like, let's just do it. Let's just do it. And we set up the first ever Latina Lactation Week. So, but thank you for that questions. We do have grants from other counties. And we are applying to local foundations. We are looking into establishing contracts with hospitals because they don't have groups, for example, in their services. So yeah, we're very creative and we have a lot of flexibility. So if you have any ideas, we'll appreciate it. We continue looking for opportunities. Or business model, it's really it's a cooperative model. So it's really grounded on social justice and giving to community and building capacity internally and externally. So it's a very unique model of working that is also has some challenges in terms of funding, but we're hoping that with the support of Edgewater Collective and partnerships, we can make this happen. Thank you for checking on that.
Thank you. Any other questions for this team?
Great work.
We really appreciate you being here. Rochelle, did you have a question?
Not a question. I just wanted to say congratulations. This is such a great project. And I think that any breastfeeding support that we can give the community is awesome. So I'm super excited to hear about your project and to learn more moving forward. So thank you for the presentation.
Thank you. And with Harriet shaking her head yes, and me shaking mine, we all agree. Thank you. Okay, if there's no other questions, then we can go ahead and move to the business portion of the meeting. And again, thank you to our two presenters, Allison and Paulina. The first thing that we're going to do, we have our social justice folks that are going to stay with us. Thank you, Lynette. And Lindsay, would you do a roll call for me, please?
Sure. Rochelle Woods.
Present.
Harriet Hall. Oh, did you say present, Harriet? Sorry.
Yeah, it's
Okay.
present.
Great,
It's
thanks.
not working.
Lane Drager.
Present.
Sherry John.
Present.
And a quorum has been established. Thank you.
Thank you, Lindsay. Well, the first order of business is the consent agenda. And we have on there the acceptance of the agenda, approval of September Board of Health meeting minutes, and the approval of warrants. Is there anything in that little group that someone wants to remove and have further discussion on? Okay, seeing none, may we get a motion, please, to the consent agenda, to pass the consent agenda?
I'll move to accept the consent agenda.
Thank
Second.
you. We have a motion. We have a second. All those in favor, please say aye.
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 Any
Aye.
opposed? Hearing none, that motion passes. Public comment. I don't believe we have anyone signed in for public comment. Again, just to remind everyone that we do like to hear from the public. If they have a comment that they want to make in coming to the board meetings, they can go online prior to the meeting and get signed up. It's a very simple process. So if you do want to speak, we welcome that, and go ahead and sign up beforehand. So we will close public comment since there is no one here. Financial report, Salma. I believe you're up.
Hello, everyone. Can you hear me and see my screen? Awesome. Well, hello, everybody. For those of you who don't know me, my name is Salma, and I'm the accounting supervisor. And today I will be presenting the August financial statements. As of this reporting cycle, with 66% of the year complete, our total revenues are being reported just slightly below budget by 1%. Our total grant revenues are being reported at 63% of the annual budget, and our charges for services are being reported at 72% of the annual budget. Our overall expenditures are being reported at 61% of the annual budget, so below budget by 4%. This is primarily due to salaries and benefits, which are currently being reported at 59% of the annual budget. However, we have already allocated some of those salary savings, especially at the grant level, toward general supplies and program supplies, which is why we've surpassed our supplies budget. Capital project, we have also fully utilized our direct assistant line item, and we are in the process of spending down our charges for services or contractual services. Capital projects are being reported at 8% of the annual budget, and we are in the process of identifying any infrastructure that's needing improvement or replacement. Intergovernmental charges or payment to state are being reported at 78% of the annual budget, and interdepartmental charges or cost allocation is being reported at 68% of the annual budget. And as of today, as of August, we've utilized 55% of the county transfer allocated to Jefferson County Public Health. I do want to highlight that we are on track with spending down our county transfer, and currently also in the process of identifying any savings that could be utilized towards in-year and budgeted projects. That's all what I have for today, unless if you have any questions.
Are there questions from the board members on the financial report? Okay, we will need a motion, please, to approve the financials.
I'll move to approve the financial report.
Second.
Okay, we have a motion. We have a second. Is there any further discussion? Seeing none, all those in favor, please say aye.
Aye.
Aye. Hearing any opposed? Hearing none, that motion passes and the financial report is adopted.
Thank you for your time today.
Oh, I'm sorry.
I said thank you for your time today.
Oh, thank you, Selena. How's that new little family?
She's doing great.
Oh, well, we want to see pictures the next time you come. Don't
Sounds
forget.
good. Sure.
All right.
I'll send some.
We will move straight to the senior leadership team updates, and we're so excited for our very first update from our wonderful Dr. Story, Sarah Story from Missouri, and she's now our new executive director, and we're thrilled to have you. And you're first.
Now,
You get to give us your report.
formerly of Missouri, now of Colorado.
That's right.
Very excited about that. Won't be very super substantive today, but I do want to kind of update the board, since I have you all together, on how these last few weeks have been and what I've been focused on. And it really has been a listening and learning tour. I haven't even made it to everybody I want to meet, of course, in the first few weeks, but I think this will come as no surprise to the board. But I do want to express public gratitude for all of you, but for Jeff, our interim executive director, now public health advisor, who has just been, there's no way I could do this without him in these first few weeks. He's just been a great sounding board. And every step of the way, he's made himself available or has pulled back where appropriate. And I do appreciate that. And Lindsay Gonzalez, who is on here, of course, keeping us all moving. She is a glue that keeps us together, and she has put up so much with my popping over and distracting her from what she was doing, which is what I do most of the day. Probably on the hour, go in and just start talking to her. So she might want a door at some point, I'm thinking. Might be second guessing her open cubicle. And all of the senior leadership team, of course, has been so gracious and helpful. So I've been doing a lot, digging into, we have a lot of plans in place. We have a lot of plans in different stages of progress. So we have strategic plan and CHIP and health equity plan, all necessary, especially when it comes to accreditation. But really thinking through from a high level perspective, how those things interact with each other, how we can avoid redundancies, and then how we can make sure that that internally and externally folks know the purpose of all of those different roadmaps that we have. So really just getting a lay of the land. I thought it was a really interesting meeting yesterday between BCC and Board of Health, and I really appreciate being able to listen in on that. I went to a legislative barbecue. I met a whole bunch of elected officials and legislators. That was a lot of fun. So I'm doing a lot of that. We have a Metro Denver Public Health group that I've already met and did a retreat with. I'm going to a retreat tomorrow with Jim in Keystone to meet public health officers from all over the state. So we had a great breakfast meeting with the CEO of Stride last week as well. So we're being very intentional about the meetings we're setting up now in the next few weeks, and then we'll be opening that up more to CBOs and other leaders as we go forward. And we do have a staff meet and greet October 10th, though I've already popped into baby showers here and birthday parties here, just because one, I like food, and two, I love meeting people, and spent some really amazing quality time with staff already organically. And that's been such a joy. It's made these days go very fast. So I'm open for questions. If you have questions for me about any of the transition, other than that, I'll end my remarks there.
Thank you so much. Are there questions from the board members? You're getting off easy and light today. I'm sure by the next board meeting, we'll have 1,000 questions for you. And I do also know.
I'm ready. I'm going to invest in a fan for my office so that when you all make me sweat during these meetings, that there will be a fan on me.
Okay.
But for now, I'm feeling very well taken care of by all of you. So thank you.
Thank you. And I know each of the board members can't wait to sit down and have coffee with you and get to know some of your visions. And
yes, I would love that.
Yeah, they would too. Jody is not presenting today. He is out sick. He's been very sick for about a week. So we hope he gets well. Jim, why don't you jump in, Jim Rada?
Good afternoon, board. I only have one item to share with you, and I'm very proud to announce that this month's Employee of the Month is a member of the Environmental Health Services team. Liz Clyburn came to us a little over a year ago, I think, from Houston, Texas. And she came with a great deal of experience in environmental health, predominantly in the retail food protection or retail food safety program. And she has just jumped in with both feet and has taken on a tremendous amount of responsibilities as a senior, and has been promoted already to a senior environmental health specialist role on the team. She is currently leading our retail food training program. She's also taken on the role of our retail food program standardization officer, which is a key responsibility in terms of consistency or developing consistency amongst our inspectors. She's taken on the temporary food program, managing the application and inspection of all kinds of different temporary retail food events across the county this summer. She's become the lead of our retail food plan review team. She's very organized and has been really instrumental in making improvements and for assigning and tracking of our plan review applications and inquiries about plan reviews in the retail food industry for Jefferson County. She's always looking for new ways to make programs more efficient and effective. She's mentored a number of our staff, our new staff, and we have had a lot of new staff over the last couple of years, and helped them really to get adjusted to their new work, and has really suggested adding specific people to various teams based on her knowledge of their skills and her faith in them to perform the tasks that are needed to be done. And she spends lots of extra time with the staff that are struggling and comes up with inventive ways to help them. Liz has an extremely strong work ethic, which is really a strong reflection of our organization's guiding principles and the EH team's core values. And Liz's performance, professionalism, and commitment to the organization and its staff really embodies JCPH's guiding principles perfectly. And her exemplary commitment to drive environmental health to success has not gone unnoticed. We're very proud of her and very pleased to have her on board. I'm looking forward to having lunch with her next week. So hopefully some of you on the board will be able to join us. Thank you very much. That's all I have for today.
Thank you, Jim. Are there questions for Jim? Thank you, and congratulations to Liz. And I, of course, would not miss the luncheon.
We look forward to seeing you.
And our other board members have enjoyed coming. Many of them have already, several of them. I think all of them have gone to come. So, Joe is on vacation. He's probably taking care of all those little babies that they have at home. So he won't be presenting for us today. Christine, I did see you. There she is. Hi, Christine.
Hello, thank you so much. I just have a couple of updates, and I'm going to loop our clinic services team into my update as well. So the first update is we are continuing to monitor COVID data, in particular COVID hospitalizations, because that is a strong indicator of the effect of the circulating virus on our community. So in the process of tracking the data, we are seeing that most of our hospitalized cases are occurring in community members who are above the age of 70. Not surprising, but lots of work to be done and continuing to be done in terms of outreach and messaging to our older adults within the community. So the teams, both the clinic services team and the infectious disease team, are working hard to support that population in particular, but also all populations when it comes to COVID-19. The other announcement that I have is that our health communications team is fully staffed. Yay! We have a new staff member, Alexandra Bolivar, who is a native of Venezuela, currently worked at both CBS and Telemundo, and we are very, very excited to have her skill set on board the health communications team. So welcome to Alex, to the JCPH family. And then a big announcement for tomorrow from 8 a.m. to noon, we are hosting a Mugs for Rugs event. This week is Injury Prevention Week. September is National Preparedness Month with a strong focus on our older adult community. And in celebration of that and the approval of an updated COVID vaccine, the launch of an RSV vaccine, and we are approaching respiratory season, our Mugs for Rugs event will be held at JCPH tomorrow morning. We are encouraging older adults to bring in small throw rugs to the health department. We're going to collect those throw rugs and we're going to hand them a mug filled with a bunch of goodies, an opportunity to have conversation with preparedness teams, some of our volunteers from our volunteer database, and an opportunity to be vaccinated with high-dose flu, RSV, COVID, the updated COVID vaccine, which arrived today. We're very excited by that. And an opportunity to promote preparedness information among this community as well. So a older adult celebration at JCPH tomorrow morning, if anyone would like to stop by. That's all I have.
Thank you, Christine. I was on mute. Any questions for Christine?
I have a question. Going back to COVID, do we have the wastewater data? And are we monitoring that? I understand it's harder to get now than it was earlier during when the pandemic was called a pandemic.
Yeah, we do actually still have access to the wastewater data, Harriet. And there's a handful of sites that will be monitoring for influenza now in the wastewater data. So they're expanding opportunities at some targeted sites where there's also syndromic surveillance going on through CDPHE. But we do get the wastewater data from COVID. And we are, to the best of our ability, crossing that with the COVID case counts that are reported. If you recall, there was a change in requirements for case reporting. So we are not capturing all of the cases now, but the ones that are reported, we do capture that and sort of overlay it with the wastewater data. Similar trends in terms of we've probably seen a threefold increase in COVID cases, both in wastewater and reported cases from the second week of August to now. Not surprising, school is back in session and that impacts the spread of disease across the entire community. That hospitalization graph lines right up with that increase as well.
And a follow-up question is whether the vaccine at the health department is available to people who don't have it available from their provider.
Yes.
And people who have insurance that won't cover it.
Yep.
Yes.
Most
Okay,
insurances can be billed for at our clinic along with Medicaid. So we are open and ready to support the community for vaccination.
Specifically, if something hasn't changed in the last day or two, Kaiser does not yet have the new vaccine or the RSV vaccine. So that's, I think that's a big problem, particularly given that I have Kaiser.
Yeah, Kaiser we can't bill for thanks to the model that they have.
Right.
I will say, Harriet, that in supporting community who have reached out to us with that exact question, I will advocate for our pharmacy partners who do have it in stock. If there is a concern and a need and an opportunity, those large pharmaceutical chains are ready, willing, and able to support vaccination. So not ideal with out-of-pocket costs, but it is ideal if you are concerned and need an option along with JCPH, of course.
Thank you. Any further follow-up, Harriet?
Nope, those are my questions. Thank you.
All right. Okay, well, Christine, as always, thank you. Will we see you next week at the luncheon? Are you going to be there?
I will not
You
be at
haven't?
that one. No.
Oh,
Thank
okay,
you.
well, I'm sure you'll be to the one after that.
I'll loop back around, Sherry, I promise.
Okay, Alex, last but certainly not least, coming to give us a report on the family services.
Yes, good afternoon. Thank you, Sherry.
Yes.
I also have a very quick, brief update from Family Services. Thursday starts the annual Public Health Conference, Public Health in the Rockies up in Keystone. And we have 2 presentations from the Family Services Division taking place this year. I'll be presenting on the implementation of Family Connects with partners from the 3 other pilot sites of Eagle, Boulder, and Denver. And then in a little more exciting is we have 3 staff, Carolina Fejas, Jenny Mitchell, and Amanda Davis, who along with partners from Jeffco Public Library and K8 Arvada Public Schools will be presenting on building a culture of connection, how storytelling empowered and cultivated community in Jefferson County, Colorado. So very excited for these 2 presentations. And that's it from Family Services.
Well, thank you. And thank you for representing Jefferson County Public Health at your conference. Okay, are there any further questions from for Alex from the board members?
No questions, but we
Seeing
can
none.
represent Alex at the conference. That's awesome. Getting the privilege to present like that. Congratulations to your team.
Thank you. And I think, Christine, correct me if I'm wrong, but do we have another presentation from Data Epi presentation?
There's a Data Epi presentation and there is a presentation from Points West as well as one from immunizations. So we are well represented in terms of sharing data and information up at the conference among our colleagues. It's very exciting.
That's great.
Brag
That's great.
today.
Okay, are there any staff comments? I did not become aware of any before the meeting. Do I see any hands that come up for the staff? Okay, let's move straight to Board of Health comments. Is there any comments from the Board of Health members? I would just start by saying, yes, we have the end of the Employee of the Month luncheon next week. You don't want to miss that. And if any of the other board members can get away from their daytime jobs, we'd love to have you. And then the other thing that I want to do is, besides welcoming our wonderful Dr. Story as the new executive director, I do want to one more time take the opportunity to thank Jeff, who stepped in and has just done a fabulous job and has done a great job with helping to do the onboarding, and he's just been a real asset, and we're glad that he will be able to continue in a consulting manner. Other board members? Lane?
Yeah, so there's an advisory group panel that the state health department is putting together for Board of Health members, and so I have applied for that. Initially heard I think I'm going to be put onto that group, but it's an opportunity for us to inform the state on some of the training needs and overall needs that Board of Health members have. I think we've identified a lot of things that we've tried to figure out how to build ourselves. And so getting resources statewide to implement onboarding, for our new board members, more integration across boards and collaboration opportunities. So I'm excited to share some of the thoughts and lessons learned from trial and error to some degree that we've had, and hopefully create some stronger systems moving forward.
Thank you, Lane. And that is really good to hear. You'll be a great representation for our public health board and Jefferson County Public Health overall. Harriet, I saw that you had unmuted.
Well, so congratulations, Lane. That's great that you will be representing us. I want to echo the thanks to Jeff. It's been wonderful knowing that we had that kind of expertise to guide us, until Sarah came. And Sarah, huge welcome to you. I look forward to coffee sometime soon and getting to know you better. And I just want to say how upset I am that again, 2 times in a row, the Employee of the Month, I have a doctor's appointment, so I won't be there. That's all.
Well, we're sorry that we're going to miss you. Okay. Rochelle, do you have comments from the board for your comments?
See, I always like to speak last during these meetings because then I just get to say, I mirror everything everyone just said. So yeah, Lane, that's awesome. I couldn't be more excited to know that you're a part of this new group, because I know that you're going to be an asset for that team, just like you are this team. So congratulations. That's great news to hear that. Again, just dazzled by hearing about our breastfeeding efforts in the community. I think that's so important. So I always love to hear about that. So that was a really great presentation today. I'll be redundant. Dr. Story, again, welcome. Looking forward to having the opportunity to sit down with you. Again, mirroring what everyone else said. But no, great meeting. I think things are going great. And that's all I have to say today.
Well, thank you. Okay, are there further comments from the board before we adjourn? I think that I really do believe we've made a record time. It's 4:23. What can I say?
I just had one last thing. First, thanks, Rochelle, for those very kind words. I think there's some potential opportunities. The meeting we had with the commissioners, I think there was some shared thought about providing more opportunities for community engagement and highlighting public health specifically. So thinking about that, not to add extra things for staff, but again, I think we would certainly want to seize opportunities when the commissioners are engaging with the community to also highlight, the amazing work, because we get to hear it month in and month out and see emails regularly, but I don't think the rest of the community knows about this, and that even our commissioners are not as well in the loop. So I think those are other things that we want to think about strengthening too, is sharing more of these stories and examples, and then also finding those opportunities to bring community members to highlight the lived experiences and the successes too. And definitely during the next legislative session, as we see policy efforts, thinking about those community partners and members that we would want to, be able to raise up their voices.
Thank you, Lane. And I would definitely agree with that. I think that it was a good meeting. And I think that, as you pointed out several times yesterday, and I know Harriet spoke, and getting more of a collaboration so that we really understand what they're looking at, what they understand what the Jefferson County Public Health Board is looking at. And I think that there was some great dialogue. So I look forward to that. Okay. I don't see any other hands going up. So with that, we will go ahead and adjourn. It is 4:25, and we're adjourning the Jefferson County Public Health Board of Health meeting. Thank you all. Have a great rest